Health psychology content, explanations for substance misuse. Drugs are mind-altering substances. Substance misuse refers to the use of a drug in a way that affects the individual's mental and physical health. The use of a drug is abuse or misuse when it interferes with social and personal functioning. Some drugs, such as barbiturates, are prescribed for physical and/or mental health problems, and other drugs are called recreational drugs because they are taken purely for pleasure. Biological explanation, neuronal transmission. How the drug works in the brain. Neuronal transmission can explain why there is a pleasure response and why there is a tolerance effect, where more of the drug is needed to get the same pleasure response up to a certain quantity. A drug, like a neurotransmitter, acts at the receptors of the neuron. This occurs at the synapse. A synapse is the gap between the receptors of one neuron and the terminal buttons of another. A drug, recreational or medical, can be taken up by the relevant receptors of a neuron, or the drug can block receptors so that uptake of a neurotransmitter does not take place. For example, heroin works like morphine. It acts on opioid receptors, and this activity causes changes at the receptors. The receptors of two neurotransmitters, dopamine and serotonin, are involved in drug misuse and addiction. Both of these neurotransmitters are linked to pleasure and positive emotions. Opioids, like heroin, slow down brain activity and uptake of neurotransmitters, so dopamine messages stay active for longer, again giving pleasurable feelings. People continue to take the drug to get pleasurable feelings, which explains drug misuse. Some people may have underdeveloped dopamine or serotonin systems, and so would seek more pleasure and be more likely to return to drug use. This could explain why some people are more likely to become addicted than others. Evaluation, strengths. PET scans have shown that neuronal activity when someone is smoking a normal cigarette is different from when someone is smoking a low-nicotine one. This suggests that neuronal activity is affected by nicotine and is evidence for the biological explanation. Animal studies show that different drugs affect receptors in different ways, which is evidence from the biological explanation. Also, as such studies can be repeated, reliability of the findings can be shown. Weaknesses. Animal studies have findings that might not apply to humans. PET scans seem to show valid behavior because they involve real behavior, but the situation is artificial, so the findings might lack ecological validity. A social learning explanation suggests that people learn by observing role models and then imitating their behavior. The individual observes, pays attention, remembers, and then imitates if motivated to do so. The role model is likely to be someone similar to the individual and also someone the individual identifies with. Role models can be parents or peers. Both fit the social learning theory and with the evidence. Baer et al. 1987 found that both parents and peers were likely to be role models in general, so it makes sense to say this is true for drug misuse behavior as well. Positive reinforcement is part of social learning theory. People continue with behavior they are positively reinforced for, so praise or being seen as part of a group is likely to maintain the behavior. Younger adults seem more susceptible than older adults. High-status people have a stronger influence in general, and also the particular drug goes with the peer group influence. Vicarious reinforcement can help to explain why, though taking a drug for the first time tends to be a bad experience, people do it again. If they see others, such as friends, parents, celebrities, enjoying the experience, then they are more likely to repeat the behavior. Evaluation, strengths. Bandura and others have shown the effects of social learning, such as behavior modeled by adults and repeated in laboratory conditions by others. So there is a lot of reliable evidence that people imitate role models and what they observe, including evidence for vicarious reinforcement. Social learning has been shown in animals. For example, when monkeys show fear of a harmless object, other monkeys show fear of it as well, just through observing the fear of others. Weaknesses. Ennett et al. 1994 showed that friendship cliques and smoking did not go together. In their study, smoking did not seem to be the result of people conforming to peer behavior. This goes against social learning theory. It is hard to show a cause and effect link between observed behavior and acting out of the behavior. For example, parents can be role models, but they might also pass on a gene linked with the addiction.